Hi, my name is Dr. Danielle Crane. I'm a clinical psychologist, and today I'm going to be answering your most Googled questions about psychologists. Our first one is, can psychologists diagnose? So yes, we can diagnose mental health conditions. There are some limitations to that in the sense that we have to make sure that we have enough expertise in that particular area and that we have completed any relevant training in assessment of that condition. So, for example, I have a lot of experience working with dissociative identity disorder, and I've completed SCID-D training, which is the assessment measure that we use to assess that. So I would feel comfortable diagnosing someone with that particular condition. Whereas autism, whilst I have a lot of experience in the area and I can generally recognise when someone has it, I haven't completed the specialist training in ADOS assessments, so I wouldn't feel comfortable making any official diagnosis regarding that condition. We also, as part of any diagnosis, would be consulting with colleagues, supervisors and other professionals as part of an MDT, because often there can be significant overlap between different diagnoses, and we want to make sure that we are coming to an accurate diagnosis. The other thing to note is that whilst we do diagnose, that's not generally the part that we focus on most. We tend to focus more on a formulation in terms of informing your treatment. So a formulation is where we gather all the information that we know about you and we come to a shared understanding with you about your difficulties, where it is much more personalised to your particular experiences rather than more of a sort of generic list of symptoms associated with the diagnosis. Our second one is, can psychologists prescribe medication? No, generally we cannot. Generally we just provide talking therapies. Can psychologists diagnose ADHD? Yes, we can, as I said, if we've completed specific training in that area. Can psychologists diagnose autism? As I said, if you've completed training in things like ADOS assessment. Can psychologists tell the police? Depends what it is. So if you came to an appointment and you said, I am intent on blowing up this building, then we're not going to keep that confidential because we have a duty of care to protect you and to protect other people. So in that instance, we would be contacting other services to keep you safe and to ensure that that doesn't happen. However, there are other things that if you tell us, we don't have to disclose to the police. It's mainly if there is immediate risk of harm to you or someone else. So, and you can also discuss with your psychologist the limits of confidentiality, and that's the thing before you disclose something if you are concerned about it. Can psychologists have tattoos? Yes, we can. I actually do have a tattoo, but it is of a freckle, and it is one that I only got to win a bet with someone. But I also know other psychologists who have like full sleeve tattoos, and that's fine. Can psychologists section you? So generally, if I had significant concerns about your ability to keep yourself safe, and I'd done everything possible in the community to manage that, and I felt that actually, yes, you do need an inpatient admission, I would not be immediately doing that myself. I would be contacting other professionals for a mental health act assessment. So it needs to be done by specific professionals in a very specific way to make sure that it actually is legal and it is being done in your best interests. So we can be involved as part of that process, but it wouldn't be us personally sectioning you in that exact moment. Do psychologists diagnose? We've talked about it. Do psychologists get paid well? So yes, relatively speaking, compared to certain other professions, we do get paid well. That is partly because we are not being paid for our time, but also for our expertise and training that we have completed in order to be in that role. And also a lot of the time we have worked voluntary roles or very low paid roles for many years prior to completing our psychology training in order to make sure that we have enough experience in mental health services. And also because our role is very challenging and high risk. We are, responsible for keeping people alive. So it is a reasonably well-paid job. It is also a very challenging job. Do psychologists work in hospitals? Yes, we do. Obviously, there's a lot of mental health inpatient units, but also you'll find psychologists within A&E or within sort of critical care services, and that's the thing as well. Do psychologists wear scrubs? Not generally. It's generally more kind of smart casual clothes. We try not to look too smart because we don't want to have that sort of power imbalance of us seeming kind of superior or unapproachable, that sort of things. That's why we tend to be more smart casual. But I guess there might be some inpatient units that have more specific uniform requirements. Do psychologists have to report crimes? It depends on the crime. It's not a blanket thing that any crime you talk about, we have to report. If you come and you're talking to us about drug misuse, we're not going to tell anyone about that. It's only usually if there's a risk of harm to someone else or yourself that obviously we need to be more concerned. Do psychologists have to be registered? Yes, we do. So all clinical psychologists have to be registered with the HCPC. You can actually go on their website and search a psychologist's name to check that they are registered if you are about to start private therapy. And you can also contact HCPC if you feel that a psychologist is doing something that they should inappropriate or they're not competent, all that sort of things. You can also contact them. That's our sort of governing body. Do psychologists need a PhD? So we aren't medical doctors like our psychiatrist colleagues. We have a clinical psychology doctorate, and that is a sort of clinical or professional doctorate that is slightly different from a PhD, which is an academic doctorate. Will psychologists be replaced by AI? There is obviously more AI being used within mental health apps and that sort of thing. I imagine that will continue to expand. At the same time, I don't think psychologists will ever be sort of fully replaced by AI because the work that we do is very, very complex a lot of the time, and there will obviously always be people who prefer to interact with a real human being. Will psychology be in demand in the future? I think so, because there will always be people with mental health difficulties. And yeah, unfortunately, it's generally that there's not enough resources, and we're always trying to train more and more psychologists. Can psychologists have mental illness? Yes, we can. So obviously, everyone struggles with mental health difficulties at some point in their life. A lot of the time, people who are drawn into a career in mental health do so because they have some level of personal experience and they want to help other people. And you can still function really well as a clinical psychologist sometimes with your own mental health difficulties, but it does need to obviously, you need to be mindful of it. And if you feel that, your mental health difficulties are affecting your work and your competencies and that sort of thing, then obviously that needs to be discussed with your supervisor, and it might be that you need a break to go and get your own treatment. It is something that obviously other professionals would be raising, concerns if they felt that, you had a mental illness that was affecting your role. So yes, psychologists can have mental health problems as well. How did psychologists decide what is abnormal? So obviously we have diagnostic criteria that provide some guidance on what things are considered to be a mental health difficulty. And usually as part of that diagnostic criteria includes that the condition must cause the person distress or dysfunction within their daily life in order for it to be considered a mental health problem. So, for example, someone can hear voices and not find them distressing and it not affect their day-to-day life, and therefore that wouldn't be diagnosed as schizophrenia. Also, we do take into account cultural factors. So there are some things within one culture that are considered very abnormal, whereas in another culture might be considered completely fine and normal. So we do try to take into account where that person's from, what the general sort of cultural beliefs are, and that sort of thing when trying to decide that. How do psychologists diagnose? Through assessment, either kind of interviewing the client or getting them to complete various kind of measures, discussing it normally as part of an MDT, which is a multidisciplinary team, and then also discussing it with the client and making sure that they're in agreement with that particular diagnosis and understand it. How do psychologists use literature? Well, we read a lot of journal articles and books, and we tend to feel that we always have more to learn. How do psychologists help? We help by providing talking therapy. We'll give you a safe space to talk about difficult things and to make sense of them, and we often will provide you with different perspectives or skills that you might find helpful. How do psychologists diagnose autism? Usually by gathering a developmental history from you and your family, and then completing an ADOS assessment where we ask you lots of questions and to complete some tasks, and we then score the results and feed back to you. How do psychologists treat depression? It depends on what type of therapy you use, because acceptance and commitment therapy, cognitive behaviour therapy, compassion-focused therapy, cognitive analytic therapy, EMDR, which is eye movement desensitization and reprocessing. Those are all examples of therapies that can be used to treat depression, and they all do it in a slightly different way. So that's a hard question to answer. But just as an example, if you were to use cognitive behaviour therapy, you might focus on behavioural activation. So if someone is stuck in their bed all day, just feeling depressed, in the dark with the curtains drawn, they're not talking to anyone, they're just going over and over negative thoughts, behavioural activation would be about helping them to gradually build up their activity levels again and start talking to people or start doing small activities to try and distract them from how they're feeling and give them a sense of enjoyment and achievement, and that's the thing, and you gradually build things up that way. Or in CBT you might also focus on their thoughts, and if any of their sort of automatic thoughts are overly negative and inaccurate, and that's the thing, if they're perhaps catastrophizing about the future, then you would help them to gently challenge some of those thoughts, to look at evidence for or against the thought, and to try and replace it with more helpful thoughts, because changing your thoughts or changing your behaviour will also in turn change your mood. So that is one example of how depression might be treated with one particular approach, but there are loads of other approaches. So yeah, that's a big question to answer. Our next one is explain the Ponzo illusion. Not gonna lie, I never heard of the Ponzo illusion. Let's see if we can look it up quickly. Oh, okay. So it's two lines where they are both the same length, but because of the black lines providing that perspective, it makes it look like the line that's closest to you is smaller and the line that's further away from you is larger. So yeah, it's an optical illusion, not something that we tend to use on a regular basis in mental health. So I think that's probably enough Googling for today. If there are any questions that haven't come up that you would like to know, feel free to put them in the comments below, and I will try and make another Ask the Psychologist video in future where I answer direct questions from you. I hope that's been helpful, and I'll see you again soon.